All right, so welcome everyone. This is the Georgia CBO Orientation. As mentioned, we appreciate you all being here with us today. A lot of coordination with making sure we can find a time that works well for everyone. As we walk through today's presentation, we can hopefully answer a lot of questions, and then maybe you all will be able to post some questions for us that might support the greater good of this program and this, for everyone. So excited to be with y'all. For today's agenda, this is what it looks like. This is what we're going to cover. Myself, as kind of opening this up, I'll hand it off to my colleague, Mitra Munyon, to do a project background. From there, Kelly will walk through the statement of objectives review. We'll cover evaluation with Jamie and Liz. I will be walking through some processes and procedure, and then we'll wrap it up with Q&A at the very end. So this is our slide. Just kind of, if you don't know, now you know. We're the Center for Wellness and Nutrition. We're a program of the Public Health Institute, and we're Sacramento-based, but we work to provide support to local, state, and national partners and projects. Our goal is really to work to promote wellness and equitable practices through our vision, which is a healthy nation where wellness is achievable for all. And we do that with our mission to build capacity and leadership with institutions and organizations in order to make that happen. So I mentioned that the agenda and what that's going to look like, who's going to cover what. I'll kind of just shout out folks on the call, and if you can just give a little wave. I'm Jesse Tedrick. I'm a Community Engagement Manager with the Center for Wellness and Nutrition. Kelly Ferguson is here with us. She's a project manager. Jamie Frederick is our Assistant Director of Research and Evaluation. Liz Romero is a Research Associate. And Mitra Munyon is our Equity and Engagement Program Manager. So appreciate y'all for being with us, excited. So with that being said, I'm gonna hand it off to my colleague, Mitra Munyon.
Thank you, Jesse, and good afternoon, everyone, or you're close to afternoon, you're getting there. Good morning for us. I have the pleasure to just kind of go through some project background information for you. I know we're going to cover a lot, so I'm probably going to go through some of these slides quickly, but we'll be sharing the slides afterwards for you. And at any point, if you have questions, feel free to pause me, raise your hand. We're happy to take questions. Let's go to the next slide if we can, Jesse. Jesse did a good introduction to us. Forgive me, there may be a little bit of delay on my side. I am not seeing the slides translate, but give me a thumbs up if you guys are seeing it okay. We should be looking at a slide that covers the Georgia Department of Family and Children's Services.
Mitra, I'm not seeing it advance either, and I see Jesse is frozen, so oh, there he is back. Jesse, if you're able to advance the slide, you froze for just a moment. Perfect. And we will I will take over if needed, Jesse, so no worries. I got your back.
Thank you. Thank you. Thank you. Okay, so the Georgia Division of Family and Children's Services is the state agency that is the SNAP Ed lead in the state of Georgia. They oversee the SNAP education program for the entire state, and they are our funders for this project. And so providing some background there. Usually the Georgia State Office likes to kind of make the distinction that their program sits in the Division of Family and Children's Services in the nutrition branch, and provide that background for you there. Let's go to the next slide if we can. Wonderful. So I want to just center us on, SNAP Ed goals as the funding agency for this or the funding source for this project. The goals of SNAP Ed really are to support SNAP eligible populations and increase their understanding of healthy lifestyles by providing access to direct education programs. The purpose is to demonstrate and support behavior change that increases healthier nutrition choices and more physical activity. The kind of core base of SNAP-Ed program is focused on increasing the consumption of fruits and vegetables and physical activity by policy systems and environmental change efforts in the communities that we serve. Next slide. Really, the SNAP-Ed focus is two-pronged, really targeting interventions among SNAP-Ed target populations to, as I said, increase their opportunity to eat healthier and be more physically active in their lives, where they eat, work, play, and pray, as we like to say. But really also this is meant to be a preventative measure for chronic diseases that we know are impacted by healthier habits. And the next slide. We wanted to give you a little bit of a glimpse, if you didn't know, to the funding structure within state of Georgia, where we all sit and where you all sit in conjunction to this funding. So for some background, this funding is initiated at the USDA Food and Nutrition Services Department, and it goes from there to the Georgia Division of Family and Children Services. Now, primary nutrition education and PSE activities are ran through the implementing agencies that are funded directly by the Georgia Division of Children and Family Services. Those are the 5 agencies: Health Empowers, Open Hand, Georgia DPH, UGA, and Hand, Heart, and Soul. Hand, Heart, and Soul is the newest of the implementing agencies this year, and I'll just give a little bit of a plug for them in a few slides. But the Center for Wellness and Nutrition sits right under the state office as a contractor that is supporting their work in a variety of ways on a statewide level. And so through that structure, we are funding each of your 3 agencies. Excited to bring New Life Community Alliance, Quality Care for Children, and Urban Health Initiative all into the fold for the SNAP-Ed funding. And so this is just kind of a visual for you as to how the funding flows through the state. Let's go to the next slide if we can. So I've kind of covered this a little bit, and I feel like we can say it in a variety of ways. But at the heart, SNAP-Ed is an initiative that is set up through the state in order to provide direct nutrition education and physical activity education to SNAP-eligible populations in order to increase knowledge and understanding about healthy habits, as well as to kind of encourage those healthy habits through policy systems and environmental changes and social marketing campaigns. Next slide. I feel like a little bit of a broken record, but the emphasis here is really to establish those healthy habits, those healthy eating habits by eating more fruits and vegetables, and decreasing consumption of sugary beverages and increasing physical activity. These efforts are coordinated in order to prevent nutrition-related chronic diseases. Next slide. The nutrition education components of SNAP-Ed are grounded in the dietary guidelines for Americans, and primarily use Choose My Plate as a foundation for those lessons. So again, the message here aligns with the core goals of SNAP-Ed: increasing consumption of fruits and vegetables, increasing physical activity, and decreasing the consumption of sugary beverages while increasing the consumption of water. Next slide. This gives you a little bit of a picture of what SNAP-Ed programming looks like in the state of Georgia. And so as I come to this slide, I want to make sure that I'm giving a little bit of space to talk about how we came to this CBO opportunity. So as you can see, the existing implementing agencies cover programming across the state, but there's a lot of areas that are missing in this perspective. And so the CBO initiative is really meant to provide opportunity for new implementing agencies to potentially come into the fold to support more of Georgia that is maybe being less served through the current programming. And so on the next slide, I'll be able to show you a little bit of the programs and initiatives that we see throughout the state. And it just gives you an idea of what some of those dots and some of that programming across the state looks like. Programs that range from, direct education through community gardens and kitchens, cooking classes, programming at the Fresh Market, school-based training systems. There's a variety of different ways you see SNAP-Ed programming coming kind of in the community throughout the state. Let's go to the next slide. I was expecting one other slide and I think that I missed it. So I'll just lay one more point that I want to make sure that I'm connecting. We highlighted the 5 implementing agencies, and I mentioned that Hand, Heart, and Soul was the newest of the implementing agencies. That's really the path that we hope for this project to go through. As I'm about to pass it on to Kelly, I'll just say that the Hand, Heart, and Soul was one of the agencies that we have here today last year. And so they went through the CBO project and initiated an initial project last year and built up through the year to apply for to be an implementing agency at the end of the year. And so that's really the pathway that we hope to see agencies that go through this process to be able to do. And with that, I will go ahead and turn it over to Kelly, I believe.
Great, thanks, Matria. Yeah, so wanted to spend some time talking about the statement of objectives. But before we did, I just want to pause and to see if there's any questions for Matria that we can answer before we start moving forward. I'll pause for just a second. I saw anything come in chat, but all right. Next slide, please. So obviously we spent a fair amount of time with each of you kind of working on this deliverable-based statement of objectives. And so this is to serve as a little bit of a review and also to kind of, make it a way to kind of tie to some of the kind of overall processes and procedures that Jesse will talk about a little bit later on. But basically a deliverable-based statement of objectives is you're going to complete a specific activity. We'll go through some of the objectives that or the deliverables that apply to everybody. And then, during our individual meetings with each organization, we'll talk in greater detail and go over those things with you that are specific to your site and your project. But nothing should be new with regards to those. They're all the things that we worked very hard in is when we were setting up your contracts. So your specific activity, from that, you will turn in all deliverables, whether that's an attendance sheet or curriculum development or something like that. You'll submit your invoices monthly and keep your receipts for future records. So a deliverable-based statement of objectives ties payment to the completion of a specific activity and deliverables. There is, a timeline in there along with those. You're welcome to turn in things early so that, if you want to invoice, sooner, you can do that. But everything will be tied to, those specific activities. Each activity was estimated in the negotiation phase to cover all necessary costs, incorporating salaries, office expenses, compensation, and event coordination fees. Like I mentioned, please refer to your specific objectives for the negotiated amount for each activity. Next slide. All right, so objective 1, this is the same across all of the sites. So we'll go into this in detail. great news, 1.1, y'all are here. Thank you guys for showing up this morning. And it will be really nice to be able to have that first objective checked off. Participate in 2 to 4 trainings and have some sort of proof of attendance for those trainings. Coordinate with CWN research and evaluation staff, which they'll be sharing a little bit more about that later on, but to develop an agreed upon evaluation plan. So this could be documented meetings, agendas, quarterly reports, things like that. Next slide. All right, and so continuation of objective 1. So participate monthly technical assistance calls with CWN. We will be talking a little bit more about getting those scheduled here soon. So we'll work to kind of set up something that will be like a regular check-in, monthly check-in date, and we'll meet with you guys on a regular basis to offer support, provide feedback, and things like that. So again, looking at, some sort of documentation of the scheduled meetings, an agenda, and then the quarterly report to go along with that. Attend and present at the 2024 CWN CBO convening. Did not realize we put a little bit of a tongue twister in there when we were putting this together. Convening of the funded CBO projects in September. So again, we're looking for like proof of attendance, a certificate of completion. And then final program and evaluation report coordinated with the CWN staff for feedback and formatting. So first draft is due by the end of August, and then your final report will be due by the end of September. All right, next slide. All right, so additional objectives, like I mentioned, we had additional objectives, which is the bulk of your specific programming that were developed in coordination with each site. Y'all were working right alongside of us to get those set up. So review the key dates and deliverables. So I know that we did have like a little bit of a delay at the beginning of things with regards to the contracts. So while those dates are in there, we're flexible. When Jesse goes over some of the template later on, you'll see that we have the opportunity to, if we need to make some adjustments or like things are just reality happens and things are looking a little bit different for, how you guys are putting some of that together. We'll just have a conversation, include that in there. So, no worries about that. They're just, in there as a guideline so that, we've got those, kind of as like the expectations. I would say the biggie is the final end one, and, stuff before that, we can go ahead and, kind of continue to communicate and work through that. But obviously we want to make sure we're getting you guys paid in a timely fashion to support the activities. So, we'll make sure that we're doing that in coordination with y'all so that you guys have the support that you need. And then use the monthly check-in meetings to ask questions, get support, and talk about specific deliverables. We're here to help y'all. So, utilize that time during those meetings so that, we can do our best to make sure that you all have the resources that you need. Next slide. All right, so this is just a little bit of a preview of kind of like the overall project flow. Again, hooray, we can check one of those things off that you're here for orientation. Schedule monthly check-in meetings. So we will be sharing out a SurveyMonkey to allow you guys to see some dates that we've kind of identified for, whether it's like the 3rd Wednesday or the 4th Monday of the month or whatever that ends up being, so that we've got some regular check-in times. IRB human subject training. We don't know if that's going to be needed. So it's in there kind of grayed out. We don't know that all of the sites will need it, but as we work with research and eval, we'll determine if that's something that your site is going to need. And if that's something that that your team members have already completed, please feel free to share that information with us. You can share us via email and just let us know kind of where your team is at. But we'll, like I said, talk about that more with the research and eval team to determine what is appropriate for your site. Participate in monthly check-ins, so reference the meetings there. Submit a monthly or quarterly invoice. So technically, we want to have them at least quarterly, but if it is going to be more supportive of your activities, you're welcome to submit them on a monthly basis so that you have, more consistent flow of the reimbursements coming in. You'll also submit a quarterly report. Present and attend at the CWN CBO convening, complete N pairs or pairs requirements. Research and eval will talk to you guys more about that as well. and then submit the final report. Okay, next slide. Right, so your project team. So this slide just has all of your kind of primary contacts for things. So you can see broken down by the CBO, who you'll be working with. And you're welcome to keep me and Jesse both in the loop. Same thing with like Liz and Jamie. We'll all be there to kind of support, or if somebody is out of the office, we'll be there to support. But when it comes to like submitting invoices or kind of the main person that you would be reaching out to. This is who that would be. Same thing with evaluation. You've got Jamie and Liz kind of broken up that way. And then if you are needing anything extra, you always have Mitria there as an additional support as well. So, please don't hesitate to reach out, but hopefully, hopefully you guys will feel well supported throughout this process. All right, next slide. All right, and then this final slide, and Jesse will be, oh, good, Jesse already put it in there. Thank you, Jesse. Is just talking a little bit about the programmatic monthly check-ins. So we have the link there in the chat. And then if, you can also, if you feel like using the QR code, you can also scan the QR code. They're scheduled for an hour each month. We'll use this time to discuss, and coordinate planning, answer any questions, provide any technical assistance support. And then with these meetings, just want to say that what we put in there is, something that I would say for the most part is going to work, between, now and then through September. So, we understand that some of those dates might need to be modified. So you'd basically be choosing the time that is generally going to work for you with this. I know, just for example, I know one of the weeks that in there, I think Juneteenth this year is on a Wednesday. And so I know that is a national holiday that is observed by our offices as well. And so I know that that's a date in there that, we would need to, make some adjustments to, but for the most, the rest of the year, should work fine. So kind of keep that in mind when you guys are selecting the dates. So, if you'll fill that out just so we can start getting those scheduled. I know everybody's anxious to get started. So we do have dates starting in March. So we'll get those on the books as soon as possible. All right, next slide. Right, and so I'll be asking Jamie to join us here, but did just want to pause if there's any questions before we move forward. And we will definitely have plenty of time for questions at the end too. But if there's anything that I can answer immediately, feel free to come off mute or drop it in the chat.
Kelly, I'll reserve my questions to the end. Thank you.
Okay, thanks. I appreciate it. All right, Jamie, I believe the floor is yours then.
Sure, now we are going to talk about a little bit about evaluation. This is just a few slides here with a quick intro, but thinking we should probably schedule another meeting to go deeper into evaluation. So I will pass it to my colleague Liz to talk about the first few slides. Liz and I will be the evaluation contacts for this project. So off to you, Liz.
Yeah, thank you, Jamie. Hi, everyone. Good morning, good afternoon. So we'll be talking a little bit, giving kind of the overview of the SNAP-Ed evaluation. And so here in this slide, we're talking about the SNAP-Ed evaluation framework. If you haven't heard about it already, the SNAP-Ed evaluation framework and an interpretive guide is a tool for SNAP-Ed programs to use. All SNAP-Ed programs use these 51 indicators to measure the successes of their programs. And so for each indicator, the evaluation framework and interpretive guide will provide details of background, the research and measurement instructions for each of the indicators. The framework gives guidance on measuring the direct education interventions, the PSCs, the policy, systems, and environmental changes, and social marketing efforts. And so in the chat, we have the SNAP-Ed evaluation framework guide and the framework in there for you as well. And next slide, please. I know Kelly had mentioned the SNAP-Ed reporting for pairs and N-pairs. And so for that one, for many years, it's been a common online system for states to report their SNAP-Ed outcomes called pairs. And in the past year or two, they have rolled out also something called national pairs or N pairs, as you see there. And so with the development of national pairs, states have more requirements of what they have to report back to FNS. And as part of the evaluation requirements, as Kelly had mentioned, we will ask you to enter your SNAP-Ed data on a worksheet or enter directly into pairs. We haven't quite determined how that's going to be yet, and there will be more information coming your way very soon. And so there's no action needed now, but that is something just to keep in mind that it will be part of the reporting. And as you see, that the link has also been added into the chat to learn more about it. And so then I will pass it on to Jamie to talk about our IRB.
Thank you. I don't know if that link got into the chat about N pairs. Only if you're interested. This is just a FYI. Oh, there you go. Thank you, Kelly, for that. I was just about to add that. All right, so the next slide, we'll talk about institutional review board. Has anyone worked with one in the past at your organization? Are you familiar with them? Feel free to come off mute or raise your hand if you have used one in the past at your organization or in previous ones. Okay, thank you, Monica. So you're kind of familiar with that. Tammy, you do. Tammy, just curious if you could come off mute. Where do you submit your work to be reviewed? Is that through Emory? You have the IRB there.
Before, I now am based at Emory, and before they were my principal investigator for SNAP-Ed because I was with one of the larger agencies previously. All work had been determined not to need IRB review. And so just because of how most data is collected in aggregate and different, precautionary protocols,
Yes.
everything historically that we've done has not needed IRB approval. But traditionally we've sent a letter in just so we have that documented with anything, especially if anyone has future hopes of publishing. So yeah, I can see that right now in your considerations. So that can change it as well, but yeah, everything historically that I've done in the last 7 years with previous agency and through Emory has been basically reviewed but said does not meet requirement as far as having oversight from the IRB. So it was all done and everything was protected and everything was collected in aggregate. So we were basically said, you're good.
Okay. All right. Thank you for that helpful explanation. Anyone else from New Life or Quality Care for Children? I think, Monica, you said you used to use an IRB. So I guess, we reviewed your scopes of work, and for the folks that are already kind of doing direct education, PSE work, we do have an existing IRB application with the Public Health Institute. And some of that work might fall under the existing SNAP-Ed work, so we should be okay. I guess my question to you is, and we can explore this in future calls, is do you plan to publish your research that may be, separate or unique from the work that you're, so I guess, yeah, do you plan to publish your research in a new way? Are you planning to collect personal identifiable information that would be connected with, other health information? And then another question is, when we provide technical assistance to you, if there would be any case where we would need to access the data, we would probably need to go through an IRB. So it is a little bit complicated and not very clear cut. And then also if you're working with more vulnerable populations, I think considered children, for example, we may need to look at submitting to the IRB. So we will be scheduling individual meetings or do evaluation training with each group to see if we need to go through that. It can kind of delay the project, so we just want to make sure that we do this right up front and make sure that we are dotting our I's and crossing our T's when it comes to this, because it's great to disseminate your work, go to conferences, things like that, or even publish in a journal, and those journals oftentimes ask, where is that certificate that Tammy mentioned? So something to think about as you go through this project. So next slide, please. And along with that, if we do determine that your project needs to go through the IRB, and we at PHI have an IRB, then we will require for you to take a human subjects research training if you have not already, or if you don't have an active certificate, or if you've never taken it before. And we do have a free course that you can take. It's probably just a good refresher to go through the training. You know, you are more than welcome to take the training. We can send you some follow-up materials after this. But again, we won't require it unless your project will have to go through our institutional review board. So that is all we have right now for our research section. And we will be following up with another training to dive into more details with evaluation. So thank you.
Thank you so much, Jamie and Liz, for covering that. Awesome. So this next portion of the agenda is really going to look at, like we talked about, Kelly talked about our statement of objectives, submitting invoicing. I'm going to talk about how do you actually do it. And so let's jump into it. So I'm actually pretty excited. We're trying to streamline the process for, you know, being able to collaborate and allow y'all to, you know, access your statement of objectives, your quarterly reports. So this is actually, we're utilizing Google Drive so that we have a little bit of an easier streamlined process. In the past, we've had to like share over an attached quarterly report, and then you all fill it in, and then we provide feedback. We send it back to you as an attachment. And so it just, there's a lot of back and forth. So this time around, we're going to actually just, I've shared Google Drive links with all of your staff in your program. I sent it about 10 or 15 minutes prior to this call. If you, for some reason, are unable to find that email or access that Google Drive link, please message Kelly, message her, and she'll direct private message you your Google link so you can access some of the information that's in that folder. So as mentioned, you will have an Excel file that will include your statement of objectives. You'll have access to a quarterly report tab, an invoice template. I've also created some folders for you to archive your invoices and the deliverables that are attached to those invoices. So yeah, I think it will be an amazing process, a very easy, streamlined process. So let's dive into it. As Kelly previously mentioned, you'll be utilizing the invoice template that is located in the Excel file. When you submit your invoices monthly, as much as monthly or quarterly, you'll do that as a PDF file, and you'll email it to the email that is listed, invoices@wellness.phi.org, and then you'll CC your primary contact. So for Quality Care for Children and New Life Community Alliance, you'll CC Kelly Ferguson. For Urban Health Initiative, you'll CC myself. And just, I'm gonna like really emphasize this just to avoid future having to go back and forth, but when you complete that invoice template, please include the required deliverables that are attached to whatever activity or objective that you're completing. So those deliverables were were developed in collaboration with you. So it's some type of documentation that says like you completed that activity. So if you can include that in the PDF as one file, that would be amazing. If you need to attach them, that's okay too. We also encourage you to retain all your program receipts and other supporting documentation for a management evaluation at the end of the year. So when it comes to like any type of receipts or things you purchased, you don't need to submit that with an invoice through us or to us, just the deliverable that is attached to that activity. But please keep all those receipts because they will be needed later on for the management evaluation. I wanted to give you all a visual of what the invoice template looks like. So the template is already set up for you in the Excel file that's in the Google Drive. So you'll just need to update the cells to include your organization name, your address and city state. The invoice would just be like invoice number 1, invoice number 2, invoice number 3, and then an included date and the PHI agreement number. You'll want to update the objective number and the activity that you're submitting the invoice for. The total at the bottom that you're invoicing for reimbursement, and then a signature. And as mentioned, if you can attach the additional documentation as one PDF to this file, that'd be amazing. But if you are unable to and you need to attach it, that's okay as well, but just ensure you include those. Let's see. All right. So for quarterly reporting, this tab will also be located in the Excel file that is that includes the invoice template. So really, this is not like a report to be like a long, text-heavy report. This is really just to get a pulse on how your program is doing. So you'll have an opportunity to provide just a summary of general progress for that quarter, and that's based on your activities that are in your statement of objectives. So every activity is listed, and then you can just speak to the general progress. And sometimes you will have progress, sometimes there won't be, and that's okay as well. So we'll talk through that. So you'll want to talk and highlight any project to date successes, any challenges that you're facing, and then note any training or technical assistance needs that would be supportive for that activity as well. So that kind of helps us understand how we can better provide training and technical assistance. And we can check in on some of those items in our monthly check-in calls. So I also listed the quarterly report due dates down below. So for quarter 2, it's April 15th, quarter 3, July 15th, and quarter 4, September 15th. So if you want to like drop something on your calendar, those are already listed there for you. So let's go to the next slide. So just a little visual on what quarterly report looks like when you get into that Excel file. What you'll see here is an example. Let's just take, for example, the objective 1, which are very similar for all the programs. It'll have your activity listed, participate in a required training. Here's those deliverables that we discussed, which are, that supporting documentation, your due date, and then we in your guys' scopes of works, you'll see the staff that are listed. So you'll, completed orientation on 3/6. There was no challenges, none to report, and there's no training or technical assistance needs. One consideration, or one thing I want to highlight or emphasize is that there's these 3 columns that are listed. Every column needs to have text in it, or every cell needs to have some type of text. So if it's none to report, then just type in none to report. And then we will, because if you do not complete or put any text in the cell, it will be blocked out by a specific color. So it will automatically come back and provide comments on the report, and we'll say, please, if there's no progress to report, please state that in the cell. So as mentioned, you'll want to complete all the cells. And then once your primary contact has the opportunity to review the quarterly report, they'll come back to you, and then they will actually complete the following. So that is basically to say like activity complete, or they'll respond in some form so that you know that it was reviewed, and if there's additional information that's needed, they'll note that, or if the activity is complete, they'll usually put, you know, activity completed. These cells we'll coordinate these cells or this sheet so that you only see the upcoming report. So right now you'll see in your Google, in the Excel file, you'll see Q2 reporting template through March, I think March 30th or 31st. And then we'll open up the next section once the current quarter is opened. So this is kind of a tool for us and you to kind of just check on progress, see how things are going, you know, touch back on things, any items that are needed. So yeah, that is kind of what that process and procedure looks like for submitting your quarterly reports and submitting invoices with the attached deliverables and supporting documentation. I know we covered a lot in today, but I'm going to pass it over to Kelly just so we can open up some time for Q&A.
Yeah, thanks, Jesse. Yeah, like Jesse said, I know we just plugged your brain with a whole lot of information. So appreciate y'all hanging with us for the last 45 minutes. And now we want to open up some space for y'all to ask any questions. Janet, I know you had said that you were saving yours for the end. So we can start with you, but anybody else who has questions, feel free to drop them in the chat. I'll look to there for additional questions, or raise your hand, or after Janet asks her questions, we can you can come off mute as well. So happy to start there, Janet, if you want to come off mute and share your questions.
Sure, thank you so much. And this was a lot of information. I think more than we expected or anticipated, considering sort of where we are in the process. My first question is, when can Emory expect the agreement or a contract from PHN so that we can memorialize this collaboration? I know that you all want us to start the work just based on us being here and learning and understanding, et cetera. When can we expect the agreement so that we can alert our financial folks as well to set this up internally?
I can follow. So I actually sent an email yesterday to check on the status of that agreement. So you should all be receiving an email from me regarding the status of that, because based on when we submitted all your documentation, it should have been sent over by now. So I'm checking on the status, and I will send you an email once I have a better update. But it should be all the agreements. We sent that information to our internal team at the beginning of February. So
yeah,
so you'll
I know that you so in our last correspondence you had asked Tammy to clarify some information, as well as asked Tina to verify the ACH information. And so I thought we had provided that in full. So weren't sure if there was anything else outstanding, or but to date we don't have the agreement. So thank you for checking in on that. I guess the other part to my question is, will some of these details, right, the invoicing piece, the specifics, also be appended in the contract for reference, or is it all sort of in the Google Drive, if you will, and that's where we're expected to retrieve the information?
Yeah, that's a good question. To avoid additional delays, we're trying not to modify the contracts, additionally, and unless it is absolutely needed. I know we had this come up with some other sites as well. So So I think, well, there are the dates in the contract. I think, with regards to, kind of like where there's flexibility and what you're referencing within the Google Drive about that is, that it should be, it should be flexible enough that like, even though, like if we had, I'm trying to remember what date we had in there for orientation, but that that you guys will still be able to invoice without us having to like actually go through like any sort of like formal like contracting change or things like that. So without I don't have your contract right in front of me, but just based off of kind of what we've worked through with other sites is that you guys will still have the opportunity to invoice as kind of expected. If there are specific activities that maybe because of the timing of things you need a little bit longer to complete, then we will have that as like part of the discussion through the document that Jesse was referencing, which I think is what you're kind of referring to. So if I misunderstood that, please let me know and I can clarify. But yeah, we're trying not to do anything more with the invoices just because we don't want to cause additional delay, or with the contracts, we don't want to cause additional delays. But but within the actual like invoicing and the deliverables, I think that is where we can find some flexibility to make sure that you all are set up for success. Does that help?
It does. Thank you.
You're welcome.
I will say that our invoicing process here is rather complicated, as I'm
Okay.
sure you can appreciate. An academic institution with a central office that's charged
Yes.
with doing all of the invoicing for this work. Tammy, as she knows, is going to have to work very closely with the central office to ensure that everything is accounted for in terms of making sure that the invoices they submit incorporate everything that has been done, and to ensure she recoups all of the appropriate expenses. So one, my follow-up question to that is, Kelly, can I send you an email, because there are a couple of other folks centrally that we need to give access to the Google Drive. So I will send you an email with those names and include those individuals so that they're aware of not only the documentation that's in there, but they may have additional questions, just to be sure that Emory's systems can gather the information and submit the invoice in the manner that you all need it.
Gotcha. And I believe the way Jesse set up the Google Drive is that, and Jesse, correct me if I'm misunderstanding, is that you can probably, if it is a shortest distance between 2 points, just forward the Google Drive. We've kind of, sent them to you all individually just so that, we're not sharing it, across the different organizations that are represented, but the actual like link could be accessed by anybody. So you should be able to, freely share that with them. And then, yeah, I worked for a university as well previously, so I definitely understand some of the, the dynamics there. And I think, probably the best thing that, that you can do is make sure that, they've got, that they have the template and, kind of like all of the required components there, to make sure that, that those are included in any of the invoicing. And then, Tammy will be the one that, will be, kind of providing the PDFs of, any kind of supporting documentation. And so I think as long as those are all included, hopefully it is not too laborious. I know easier said than done within these big institutions, but hopefully that can, kind of keep things streamlined just so that, y'all aren't having to, have so much of, the background information and can really kind of focus in on like what's needed for that specific invoice. But again, I know easier said than done sometimes.
Awesome. No, that's very helpful.
Go ahead.
Question. So from PHI's perspective, what is the official start date for this work contract? Is it effective immediately? Did it start as of 3/1? What?
I believe I put February 1st on the agreement.
That was what I was recalling too.
And again, not having seen it, because again, from an institutional perspective, it's not formally set up here yet, for, as we would define it. And so we just want to make sure that one, the contract is forthcoming so we can set it up right away, or clarify with you if the contract is going to be delayed, we would need some sort of documentation letter, pre-award spending, whatever it is, to allow us to create a shell for Tammy and Dr. Moore to continue moving forward.
Okay. Yeah, I totally understand that. And yeah, hopefully we can get an answer from the contract team today and see what we can do to kind of escalate it to get that over to y'all so that you can, because I know that review process will take a minute as well from y'all's perspective. So we'll definitely follow up with you following this meeting and see if we can get a more concrete answer for you.
Much appreciated. Thank you.
And Jesse, I know this is your crew here, but you know, maybe for the first meeting, it would make sense for Janet, for you to attend, you know, just in case there are anything, you know, additional questions or something, or maybe set up a separate meeting. You know, the monthly meetings are primarily programmatic focused. But obviously if we are having a delay in, you know, you guys being able to assign like a you know, project code or whatever that shell that you were talking about is needed, you know, perhaps we can, you know, have you guys attend that first meeting just so that y'all are in the loop with kind of like where things are at.
Yeah, that would be great. And I'd love to invite a few of our central financial folks as well, because they'd be very interested in hearing the conversation. Thank you.
Okay. Yeah, and if you get, you know, you guys get the contract and there are lots of questions, then maybe we can set up a separate time or something like that, just so that we can still hold that space for Tammy and team to have the programmatic questions answered. But yeah, however we can support, just let us know. We'll doing what we can, you know, to get things moving as soon as possible. So
Awesome.
yeah, I know it's frustrating to have that delay, so apologies.
Indeed.
Yeah.
Oh, the last question. These slides, would they be available? Or
Yeah, so we'll share a recording with you guys so that you can have that for anybody else who needs it. And then we'll also PDF the slides so that you have like, you can access the links and share that out with any other team members who maybe couldn't attend.
Awesome, great.
Good questions. Brandy, I saw you come off mute.
I did. Hello, everyone. So my question, thank you everyone and Janet for those helpful questions. I'm thinking as well, but specific to evaluation, I know the evaluation team spoke a little bit about, you know, the tools, and I was able to grab those links and save those. We do have plans to work with a external evaluator, and so the question would be, at what point would we engage them? I've already been kind of talking with them behind scenes, having preliminary conversations just to keep them in the loop, but they're eager to get their subcontract and eager to kind of build out the evaluation framework, right? So the question would be, should they be in these monthly meetings? Is it fair to have separate evaluation meeting to get them on board? Is that something we're expected to do independent of PHI? So I'm just thinking, like, how do we incorporate, you know, I have a good handle on the program side, but as far as the evaluation, you know, ours includes quite a bit of like, you know, focus groups, and they're going to be designing a lot of things. And so I want to make sure that it's your team gives us good input so that they can do what they need to do. So we end up with a good, solid product at the end. The other part is we have not done IRB for research purposes independently. We've partnered with other agencies that required it. So we have completed that training before. So we're familiar with that, but we've never published data or used data in such a way that was usually always aggregate.
Right.
Population we discuss it. So I don't know, I can have a conversation with my team if they see this differently because of the scale and scope of this project, if they would like to see something more robust. But we have not in the past, but we have taken an IRB training. So the main part is about like, how do we get our evaluator kind of plugged in?
Yeah, that's a great question. I saw Jamie come off, so I'll pass it to her in just a second. But you know, you'll have a programmatic person on those monthly calls, but you'll also have an eval person. So if you can remember back to that slide where we showed you of kind of who your primary contacts were there, but you will have an eval person on those calls as well. So I think for your specific site, since you are using that external evaluator, it would be really great for them to attend, especially the first couple, and then you guys can decide if, moving forward, like, what feels appropriate and right. I know Jamie and Liz also plan on doing a, kind of a specific eval call here pretty soon so that they can kind of, train you guys on some of those processes. But, for your specific situation, I think that is definitely unique. So I will let Jamie answer that really good question.
Yeah, and I saw Mitra give her a thumbs up too. So yes, if you bring in your eval person sooner rather than later, that would be great. We've worked with, evaluation contractors in the past, so looking forward to working with them and getting your plan squared away. So, and great to know that you already have that human subjects certificate. If you have it and it's not expired, feel free to just send that to your point person, which is Kelly. Is that right?
Mm-hmm.
Kelly. Mm-hmm.
Y'all have to check the expiration. Are they normally 1 year, 2 years? What's the normal?
I think they're like 5 years, 3 or 4, between 3 and 5, something like that.
Mm-hmm. Yeah, we've taken it within the last, year and a half. So it's definitely within
it should
that.
probably still be good.
Yeah. So the other point is that I will share with them the links with those evaluation tools, the pairs and impairs. I think they may want to just do some learning on their own and kind of poking around so that they come to these meetings with fair questions. So I did grab those links and I will share that with them. But thank you so much. So yeah, they're eager and want to let them know that we met today. And so now we can get ready to get their part of the program in play.
Yeah, and Brandy, I think I saw that your fully executed agreement was sent over yesterday, maybe, or the day before.
Yes, ma'am. I think it was yesterday. Yep. This week. Yep.
Janet, it's happening. They are coming slowly but surely.
That gives me the green light to now engage them formally. I've been informally engaging the contractors, just kind of keeping them close tucked in so they wouldn't run away, so I wouldn't lose them. Kind of. So I'm going to be letting them know today we're fully executed. And so now I can have more formal, concrete conversations with them about their subcontract and what that might look like. But I wanted to have this conversation so I wouldn't just be speaking, from my own guesstimation, but from what you guys shared.
Yeah, no, definitely get them pulled in. And then I think for the pairs or end pairs, I think Jamie and Liz are still determining like what exactly is going to be required. So if they do start poking around in there, that's, totally fine. But we do still have like a little bit of ambiguity about like what is actually going to be required. So, if they're like me, they probably enjoy going down rabbit holes and learning about lots of different things. But if they need to choose their battles at the moment, then feel free to let them, take a gander, but more specific instruction will be coming.
Okay, I'll let them know. I'll let them know that, they may want to just big picture learning, but I'll caution them about not getting too committed to it since we're not quite sure yet.
Yeah, great. That's perfect. Thank you. And yeah, and Jamie and Liz will definitely go over that in greater detail about either where the status is or kind of like what the, expectation is when they do that specific training with y'all. Great, good questions. Other questions?
Jesse, can you put the slide back up with those dates that you gave us? I think they were like the quarter dates or something like that. I was snagging some other things that I missed it.
Sure. Give me 1 second.
I know we'll get them, but that just helps me kind of think backwards, fill in the gaps.
Mm-hmm.
And as all of this information is kind of sinking in, y'all are welcome to reach out with that, to us so we can make sure that we are doing what we can to get y'all set up for success. And then, like I said, please do try to get a response for the SurveyMonkey about the regular meeting dates so that we can get that first meeting on the calendar and, kind of get you guys moving on things. So.
I just dropped the dates for the quarterly reports into the chat box.
Excellent. Thank you, sir.
Perfect.
welcome.
Thanks, Jesse. Yeah, and remember, you guys can, submit earlier or more frequently if that is going to be more helpful to, to be supportive of the work that you guys are doing. So, please feel free to do that. Any other questions? No, team, anything else that y'all would like to add before we jump off?
I'll just jump off and say, like, we're excited about working with all of you. And, on behalf of the team, we recognize there's been quite a bit of a delay. We apologize on behalf of our systems and really appreciate your flexibility and understanding to that process. But as we know, contracts have been going out this week. We will get the final one kind of for Emeryville taken care, or I'm sorry, Emory University taken care of, and then get this ball rolling. So you guys are in good hands, and we're excited to kind of collaborate with you on this. So thanks for your time.
Thank you.
Great. Well, like we referenced, we will send out a copy of the slides and the recording so you can share that. I will also pause myself here. Tina, I saw you come off mute, so I just want to make sure we're giving some space if you have a question still.
No, I don't have a question.
Okay, great. Yeah, so but thank you all. We really appreciate your time and patience and flexibility with things, but we're definitely here to support and make sure that y'all are all set up, and we are really excited to get going. Yeah, reach out in the meantime if anything else comes up. Janet will follow up with you all on team later on today. Just even if it is no info, we will follow up just so that you've got a sense of know that we reached out and might just be waiting a little bit longer to get that update.
Much appreciated. And again, just for consideration, if there is an imminent delay, perhaps we can talk about, some sort of a letter agreement or something that will allow us to get things established here.
Yeah, absolutely understand. Yeah, gotcha.
Thank you.
All right. Well, thank you, everyone. We really appreciate your time, and yeah, we will be in touch very soon.
Thanks, everyone. Have a great rest of your day.
Have a great day.
Bye, everyone.
Monica, I hope your kiddo's feeling better.
He's still on the couch and he's not bothering me, so I don't think he's better yet.
Oh, yeah, that's always a good indicator. If they're feeling better, they're gonna be right there letting you know that they're feeling better.
Right. Stayed off camera just in case, and he didn't even come.
No.
So, but thank you for asking. I hope you guys have a good rest of the day.
Yeah, we appreciate you still joining, so thank you. All
Yeah, bye.
right, take care.